Thank you. I know I'm not tall, but in my head I feel like I tower over everybody. It is my real privilege to introduce Congresswoman Carolyn Maloney, who we have the great privilege of having here today. The Honorable Carolyn Maloney represents a congressional district that includes part of Manhattan, which, luckily for our company and our employees, makes her our Congresswoman. The district also includes parts of Brooklyn and Queens. We, in this great rare disease community that's gathered here today, are very lucky to have her with us on this occasion. As you may know, the Congresswoman has had long service on the House Financial Services Committee. But in addition to that, recently, with the tragic passing of Congressman Elijah Cummings, Carolyn was chosen by her colleagues to succeed him as chair of the powerful House Oversight Committee. In that role, Representative Maloney will oversee the work of every single federal agency and office that is of relevance to our common goal of addressing rare diseases. And coming from FDA, that's saying something. It was just as she was taking the helm of that committee that we approached her with an urgent request. As Kinnari mentioned, Rocket Pharma is leading the research into a possible cure for a life-threatening disease called Leukocyte Adhesion Deficiency 1, LAD1. It's an extremely rare genetic disease that affects the immune system and prevents those affected by the disease, mostly very small kids, from fighting infections. Unfortunately, most succumb at a young age. We're really honored that today we're going to hear more about LAD1, and we have the great privilege of having Marley and Tamara with us today to share their experiences. Rocket, in collaboration with our amazing academic partners in Spain, developed a potentially life-saving gene therapy for LAD1 and opened a clinical trial at UCLA. But we faced a huge challenge. This potentially life-saving product could not move forward unless children stricken with this condition and their families could get visas to travel to the US and on to UCLA. What's interesting about this is we always thought, we talked about all of the challenges of getting this therapy into the clinic, and the one that we just did not talk as much about was immigration. So what did we do? We contacted Congresswoman Maloney. She immediately appreciated how critical it was to provide access to the trial. And within 2 or 3 days of our request to Chairwoman Maloney, a letter to the Secretary of State was signed by her and by the chairs of every health committee in the House. And boy, did it make a difference. Just recently, our first international patient, a 1-year-old baby girl from India, and her parents were granted visas to come to the US. Their plane tickets are being purchased as we speak, and they will be on their way to UCLA within a couple of weeks. That's really what leadership is about. Congresswoman Maloney. I can't begin to thank you for what you've done. Thank you so much. We are truly honored to have you here today.